As the Democratic Republic of the Congo battles one of the world's worst outbreaks of Ebola, former patients have become the new faces of awareness campaigns. In a region where distrust of the response efforts remains strong, these survivors travel through neighborhoods, often on foot and without any resources, trying to convince communities to adopt life-saving practices. Their testimony, inspired by their own experiences, often inspire more trust than official messaging. We have this special report from North Kivu in the east of the country.
Hand washing and avoiding physical contact with visitors. It's a simple but effective way to stop the spread of Ebola. Giselle Mukotso is an Ebola survivor. Together with other survivors, she teaches Ebola awareness, and every session can mean a life saved.
We engage in awareness raising because we have lived through this ordeal. We know all the suffering endured by Ebola patients. And we are living proof that Ebola can be cured. There are already many rumors surrounding Ebola, but we are living witnesses. Our testimony is stronger because we're tangible proof of Ebola. We were infected, and then we recovered.
Sometimes the volunteers have to persuade people the disease even exists. That's not the case at this orphanage.
We have many children and many people come here. These children already know that they should not kiss people or shake their hands. I do not want Ebola here, because if just one child becomes infected, all these children will be affected by the virus, and we'll have to close this orphanage.
To reach a wider audience, the survivor volunteers are also using radio. On the show, Osei Kavunga answers listeners' questions and combats rumors. Since the resurgence of Ebola, he's been on the airwaves every week.
We want to see how we can expand our awareness efforts and reach everyone, because the disease is serious and people do not seem to be informed about it. It's spreading so rapidly. If we compare it to the 10th epidemic, it's difficult to understand.
The 10th outbreak was in 2018. That's when Dr. Maurice Mutsunga contracted Ebola. After recovering, he chose to return to the front line.
I can't abandon the patients. During this outbreak, I'm participating in epidemiological surveillance activities and in the search for suspected cases. Healthcare providers must comply with all preventative measures in order to avoid becoming infected. Not only to avoid being affected themselves, but also to avoid transmitting the disease from one sick person to another.
Another successful awareness class is over. Now it's on to the next one, armed with only their stories and their determination.
Our brothers and sisters continue to die because of ignorance. We walk through neighborhoods on foot under the blazing sun in order to dispel rumors and save our loved ones.
We're going to stay with Ebola for a moment with Greg Hamm, Save the Children's Country Director in the DRC. We find him today in Bunia in the country's east. Greg, glad you could join us. We just saw a report on Ebola survivors in Beni going door to door to fight the many rumors surrounding the disease and to convince neighbors to take basic precautions. From where you sit in Bunia, is that kind of grassroots trust-building outreach working faster than the regular messaging people get from the government?
Well, thanks for asking about survivors, because survivors are so important to the success of this response. In the first instance, they give people hope that if you have the symptoms of Ebola and if you get treatment and you go to a treatment center, there's a really good chance, that with that support that you can survive. Now, the messages that survivors are giving and community outreach is really important, but it's all part of one plan that we're working, Save the Children, the UN agencies, other NGOs, the government, it's all part of one plan. And so there are messages that come out on television and radio, messages from Save the Children through the health centers that we support. But yes, going door to door in communities is part of that plan, and it makes a huge difference. Without that community engagement, we're unlikely to stop the spread of the disease.
You're in eastern DRC, the epicenter of this outbreak. How would you describe the situation there right now?
odd situation because on one hand, I'm in Bunia, the provincial capital of Ituri, and life proceeds many ways as normal. It's not an earthquake where you see the visible pictures of the buildings collapse and the people in the rubble. This is, thousands of people are dying, but they're dying in communities and in towns across the province, across now 6 provinces. And that's the message we have to get out. Even if you're not seeing on any given day, on any given street, the visible signs of this, it is real. And we need to stop the spread because without that, thousands more people will die.
I want to make sure our viewers understand. It bears repeating. You're in Bunia, the capital of Ituri province. Now, Ituri alone accounts for over 4,400 cases spread across dozens of districts in a region where armed conflict has displaced masses of people. How much is insecurity itself driving the spread of Ebola? And are there areas your team simply cannot reach?
Well, the insecurity and the conflict here leads to, contributes to the vulnerability. Save the Children has been working in Ituri province for years, where there are over 1 million displaced people. Trying to prevent the spread of disease in the displacement camps adds to vulnerability. There are places that are not reachable because of insecurity. And when people are displaced, when people are struggling just for the basics, it's hard to do what you need to do to stop the spread of a disease like Ebola. So the fact that this is happening in a place with already weakened healthcare systems, where people are struggling for survival, makes it that much harder to get on top of this.
I want to be clear here again. You're in a conflict zone. The people who are getting infected largely are in a conflict zone. Do you believe that people are actually hearing the message that you're trying to put out?
Well, there is a challenge, and it's interesting. It's the 17th outbreak of Ebola in the Congo, and yet there is still skepticism. Skepticism, is this real? Well, do I have to worry about this? Is this not just being done so humanitarian workers can make money and be there and have jobs and the rest? And those, that it's not just Ebola disease that has this problem. There are many others where you really have to work. All of us have to do, community leaders, religious leaders, government leaders, all the community organizations, to try to make it clear that the disease is real. It's relatively easy to stop the spread. It's not like COVID or other diseases that spread, through the air. It is easy to stop the spread, but people are the most vulnerable when the emotions are the highest. So Ebola spreads most easily at death. When somebody has died of Ebola, that's when the bodily fluids are most contagious. And at people in the emotion of losing a loved one and asking them not to touch the body, not to do what any of us would normally want to do at a moment of death of a loved one, it's very, very hard. So you have all these factors coming together, which makes it so much harder to stop.
Yeah, unlike previous outbreaks, there's no licensed vaccine or approved treatment for this strain of the virus, the Bundibugyo strain. What does that mean in practical terms for your teams? Are you basically fighting this with the tools you had in 2014?
Well, I think there's a couple things about that. While there is no pure treatment, there is treatment through Ebola treatment centers with NGOs run with support alongside government that do provide care. It does improve survivability. There are things you can do when somebody has a virus, even if there's not a specific medicine for this virus. So in the first instance, care is available. Rehydration is important. The disease, you lose bodily fluids, you vomit, and getting that care is up. There's things we can do, organizations can do to help people. So that's number one. There is not an approved vaccine. There is a clinical trial about to begin for the Zaire strain of Ebola to see if that cousin of Ebola, as it were, that cousin species can make a difference. In 2014, we did stop Ebola. There was not a vaccine at that moment. So it can be done without a vaccine. A vaccine would make it much easier. And I know scientists around the world are working very hard to get a vaccine that might make a difference here.
Save the Children's mandate is, of course, children. We just saw an orphanage in Beni trying to protect 38 kids from exposure. What's happening to the children orphaned by Ebola or separated from infected parents? Does the organized response have a real plan for them?
So right now, already over 180 children have lost both parents. Many, many others have lost one parent. And what Save the Children does in these situations, it helps reunite these children first with extended family, and where that is not easily found or an easy solution, to help place children in temporary foster families where people then offer that love and support that children need. Because of the war, because of the conflict here, that is something that we have been doing prior to Ebola. Save the Children continues to do that, to help children find temporary shelter where needed, and then to be reunited with extended family on a long-term basis. It is hard to be a child in a humanitarian situation where your family has fled for your life. It is now even scarier with Ebola here. When we talk to children here in Ituri, we talk to children around the world facing crisis, but children want more than anything else. They want a safe place to be. They want enough food to eat, and they want to go to school and play with their friends. And for too many children right now here in Eastern Congo, those things are not easily found. And Save the Children and others are working day in and day out to try to make that possible.
Greg, we always end up talking about money or resources because, of course, it's vital. I understand pledges have come in, but is the money, the resources, translating into what you need on the ground in Uturu or North Kivu? Or is there still a critical gap nobody's talking about?
Money is coming, and some donors have been very generous. Much more is needed. What has been offered by government donors and individual donors is a fraction of what was put forward in the response in West Africa in 2014. And there's a serious concern that we will soon be at similar numbers in terms of death and cases as that situation. In addition, this is happening in a remote part of the world, not easily accessible. Not in West Africa was where there were international capitals. You're in a remote part of the world, it is much more expensive. The roads are not in good shape, and so more resources help has come. So much more is needed from governments and from caring individuals.
Deep thanks to you. Greg Hamm, Save the Children's Country Director in the DRC.